Welcome to the NIPEC webinar for the Person-Centred Nursing Assessment and Plan of Care Adult Inpatient Care Setting document. This document is to be used in adult inpatient care settings and for those people aged 18 years old and over. If a person under 18 years old is being cared for in an adult hospital-based environment, nursing staff must seek advice from children's nursing colleagues in relation to the most appropriate assessment dataset for use, whether that is within the adult or children's, known as Me and My Family Nursing Assessment and Plan of Care records. The nursing staff should also consult with children's nurses and specialist nurses in relation to the most appropriate risk assessment documentation for use. For example, a Braden risk assessment used for adults or Glamorgan risk assessment used for children. Any decision made in relation to assessment of the young person should be individualised, person-centred, with consent and in collaboration with his or her next of kin or guardian, as appropriate, ensuring physiological and developmental appropriateness is considered. Regional guidance and trust policies and processes must also be adhered to in relation to care of a person under 18 years old in an adult hospital-based environment. One of the most important aspects of this document is that all care planned should be in consultation and with consent of the person being admitted, or by taking into account the person's previously expressed preferences through talking to their next of kin, family members, or anyone else who is close to them. Another extremely important point to remember is that care should be documented contemporaneously or in a timely fashion. This means that nursing records should be completed as close to the point of care delivery as possible. This document is formatted using the PACE framework. If the PACE framework is not implemented in your clinical setting, you should continue using your current approach to care planning. Please bear in mind they should be person-centred, individualised and regularly updated to reflect the changing needs of the person placed in your care. Within the sections of the booklet, information is being recorded from the person's perspective and from the registered nurse's assessment. Information should be documented in both sections. The document should be completed by the registered nurse gathering the information, scoring in certain sections, for example in the AMT4, the MUST and the Braden scale, and by ticking relevant or correct boxes. There are some sections in the document which may be more easily completed as you go along during the admission process. Examples of these are page 14, the summary of identified needs, page 15 where nurses record sections that are incomplete, and page 44 where a list of referrals made is documented. For example, a referral to a podiatrist or palliative care nurse. Please don't forget to record your signature on the signature register on the final page of the document. Colour-filled banners are used to format the document. Life-critical information sections, such as the person's allergy status, are in red. Risk assessment sections are in green-filled banners, for example, the bed rails assessment. Identification of needs sections, whether acute or existing, are in blue-filled banners and are situated beside related risk assessments. For example, the moving and handling and falls risk assessments are placed before the mobility need, and the Braden scale and skin check sections are placed together in the document. A traffic light colour format features throughout this document. This system can help to indicate the level of risk that is present, and therefore the level of nursing intervention that may be required when considering a plan of care. Red indicates a high level of risk, and therefore a high level of nursing intervention may be required. An example of this is if a person requires full assistance with eating and drinking. Amber indicates a moderate level of risk, and therefore a moderate level of nursing intervention may be required. An example being that the person requires help with elimination. Green indicates that a low level of risk is identified, and therefore a low level of nursing intervention may be required. For example, if a person scores under 4 in Audit C, it indicates that a low level of risk is identified for alcohol consumption, and therefore minimal, if any, nursing intervention may be required. The traffic light colour format, however, is only a guide. Professional judgment and critical thinking must be used when considering the person at the point of admission. From pages 45 to 49, there is opportunity to document the outcome of the review of risk assessments during the person's admission or journey in the clinical setting. Although a skin check is not a risk assessment, this page is included to allow registered nurses to clearly document skin integrity issues or concerns as they occur, in line with an updated Braden. When a person transfers to another location of care, professional judgment should be used to consider whether or not a review of risk assessments is required. If the person's condition changes, review risk assessments must be completed appropriately. If the person is transferred within a health and social care trust from one clinical setting to another, the hospital ward transfer on page 43 must be completed. The discharge information or checklist at the conclusion of the document should be completed by the discharging nurse. Some sections, however, may be completed by the registered nurse prior to discharge, for example, script sent to pharmacy and transport arrangements. It is imperative that all professionals who are part of the person's community care are fully aware of the person's discharge plan as soon as possible. This should include, for example, referral to a community nurse, ordering of equipment, or organising the administration of medications. Before finishing, we would like to draw your attention to some of the important points to consider. Please remember that an assessment only captures a person and his or her condition at a moment in time, hence why documentation should be completed regularly and as needs arise. Some sections, when completed, may trigger completion of other documents. For example, completion of a Braden and skin check may indicate that a skin bundle or a similar document is required to be completed. Another example may be in relation to completion of infection prevention and control documents. For example, if a person is displaying symptoms of Clostridium difficile, the relevant pathway may require completion. It is important that the assessment process continues through these pathways when indicated. On page 13, there is a list of time-critical medication categories. These will be updated periodically by the Public Health Agency, also known as the PHA. Notification of this should come from the PHA through your organisations. You will also find a link to the PHA's website on the NIPEC microsite, Recording Care, should you wish to check the live document. Remember, there is help available, especially when the document is new to you. Please look at resources made available to you by NIPEC and consult with your facilitators at trust level.